Twin-to-twin transfusion syndrome is a very specific condition that can only happen in identical twins that share a single placenta. So identical twins happen when one egg is fertilized, and then at some stage, a few days after fertilization, the embryo can split into two. So although there are two separate babies, they share a single placenta. And again, although each baby has its own part of that single placenta, there'll be blood vessels that join the two circulations together. So in effect, these babies have a single blood circulation. And that's what makes that a monochorionic twin pregnancy, a specific identical twins that share a single placenta, more complicated, is that because they share a single placenta, anything that happens to one baby can have a direct impact on the other baby. Twin-to-twin transfusion syndrome happens in about 15% of these monochorionic twin pregnancies, so approximately 1 in 6 of those twin pregnancies. And it happens because the blood vessels that are joining the two circulations together are only allowing blood to primarily flow in one direction, which means that one baby is getting too little blood flow and the other baby is getting too much blood flow. The baby that's getting too little blood flow has got less nutrients go into that baby, and so the baby doesn't grow as well and it's smaller. Babies that have less blood flow going to them have a way of diverting the little blood flow that they do have to the essential organs like the brain and the heart, and away from the less essential organs like the kidneys. The fluid around the baby is the baby's urine, and if there's less blood flowing to the kidneys, the baby's producing less and less urine, and therefore the fluid around that baby goes down and the baby gets shrink wrapped in the membrane and is known as the stuck twin. Exactly the opposite is happening to the other baby. The other baby's got too much blood flowing to it, and therefore that baby's heart can't cope with the excess volume. And so what the baby does is to try and reduce the blood volume by peeing out. And therefore the fluid around that baby increases. And unfortunately, as things get worse, that baby can go into heart failure. So when twin-twin transfusion is significant or anything more than just mild, we need to do something to try and stop this unequal flow of blood between the two and try and help each baby continue to grow. And what we can do is to put a telescope in through mum's tummy, into the womb, into the sac of the baby that's got too much fluid, and have a look at the placenta from the inside and look at where those blood vessels connect the two placental circulations together, and using a laser burn them away so that we can separate the placenta almost into two, so we leave each baby with its own share of that placenta, and we stop this unequal flow of blood between the two and hopefully cure the twin-twin transfusion syndrome. It's a high-risk procedure. It's not guaranteed to work, and therefore we only do it when the twin-twin is more than just mild, because we know that once it goes beyond that stage, it will always get worse and the outcome is poor if we don't do anything. Whereas with mild twin-twin, we just watch, because often in 2/3 of the case, it may just stay mild or indeed get better by itself, and it's not worth taking the risk of the laser. But the moment it goes beyond that, then we have to take the risk of the laser, because the risk of not doing anything is higher.